Welcome everybody, with you Dr. Magdy Abdel, consultant of infectious disease, hepatology and gastroenterology. Our topic today about fibromyalgia. This is considered chronic condition. The patient complains of pain all over the body, and this pain is chronic, and the places include upper limbs and the chest, and the lower limbs and the abdomen. So the pain is considered chronic and include all the parts of the body. As soon as you touch this patient, he feels severe pain. And also this patient, mostly females usually 9 to 1 as regard the male. And this condition usually appear from 20 years until 50 years, but some cases below 20 years, and some cases appear after 50 years. 75% of these cases, there is difficulty in diagnosis it. And the percentage of this condition between 2% until 8% of the population. So fibromyalgia is present all over the world, and as I told you, more in females. It is functional disease, and it is not mental disease. The patient usually suffer from tiredness and the difficulty in sleep. This patient complain of insomnia, and this patient also sometimes obese with lack of exercise. Sometimes of this patient complaint of depression and tenderness all over the body, and the patient sometimes complain of easy fatigability, and he cannot make the usual works. And this patient sometimes suffer from irritable bowel syndrome, or sometimes there is some problems in bladders, and sometimes tingling sensation or numbness sensation. Some of these patients complain of anxiety or post-traumatic stress disorder. As regards this patient, most of them complain of psychological trouble. The cause of this condition may be genetical or sometimes environmental causes, because we find this condition in some families. Also maybe environmental causes, but until now there is no specific cause for this condition. As regards the diagnosis of this condition, there is no specific diagnosis for this condition, but we depend in the diagnosis about pain all over the body more than 3 months in upper parts of the body, and also in lower parts of the body, on right side and in left side. So general pain all over the body. And also in some cases we have to diagnose it correctly. We have to make some investigations to exclude other conditions. So in the diagnosis of this condition, it must be no other causes. Also in the past we depend on tenderness points, about 18 tenderness points, but nowadays we do not depend on this factor. As regards the treatment, usually we give pregabalin or gabapentin for these cases, and also antidepressant drugs. This improve this condition. But the most important, we decrease the weight of this patient because, as I told you, the obesity is an important factor. So we advise the patient to make some exercise and to improve also the sleep. If the patient sleep more and if he eat healthy diet, most of the conditions improve. So as regards this patient, also sometimes we give duloxetine or milnacipran. These medications improve the condition of this patient. Some research work find that interleukin 1 and the interleukin 6 increase in the brain of this patient, and some research work find that the growth hormone decrease in this condition, and we find that cortisol increase in this condition. But now, anyway, no specific cause for this disease. Fibromyalgia, as I told you, 75% of these cases, no specific diagnosis for it, and there is difficulty to diagnose it. Usually the rheumatologist who diagnose this condition and who decide the specific treatment for this condition. But the most important point is that we have to rule out systemic lupus erythematosus. We have to make anti-double strand DNA to rule out it. And also rheumatoid arthritis. We have to make anti-CCP to rule out this condition. Also, some diseases like multiple sclerosis, chronic fatigue syndrome, and also myositis. All these conditions, we have to rule out it before diagnosis fibromyalgia. There is important point is that the disease is functional disease, affects fibrous tissue and muscle tissue. So we called it widespread pain of muscles and connective tissue. So as regards these conditions, we have to diagnose it correctly to improve the condition of this patient. And we have also to make social support, because most of these patients usually do not make the usual routine work. Thank you very much.